Everyone, Debbie Reed here, Think Healthcare Solutions, Trust Fund Healthcare, and the Altitude Academy. Yeah, lighting's still bad this morning, and I just don't care. I've got too much to do, and you're not here to see me. You're here to hear what I have to say, hopefully. And please encourage you again to pass the word along, let people know that I'm here, and I'm diving deep into the healthcare news, all areas that of interest. My take on things. Doctors have their take. They miss a little bit on from their perspective. And as a nurse that's been around a long time, both at the bedside and in the financial end, I have a take on how things are going. So this is a follow-up to, I think I said Ask a Frustrated Nurse, didn't I? Episode 26. So this is a follow-up to yesterday when I talked about the hospital buying HCA buying 5 Stewart facilities here in Utah. Well, I just found an article here from the 30th of March that I missed earlier, that the American Hospital Association has responded to a request by the FTC and their thoughts on revamping the merger guidelines. And the antitrust enforcers. So they responded back with 2 things. They said overall it does need to be changed, but here's 2 big things that we'd like to see reflecting in the decisions made by the antitrust enforcers. The first being the to correct the defects in the economic model that they use to evaluate hospital transactions, which is one of the things and reasons that HCA responded to their purchase of, hey, it'll be really great if we buy these hospitals. We'll be able to invest and give more care to patients, whatever. Also gives them manpower. All of those hospitals have doctors groups attached to them. They're owned by the hospitals. Every one of them does. Whether it be just a family practice group or the whole gamut of obstetricians, pediatricians, and the like. So all these they're taking on not only the hospital but the hospital clinics as well, which I really don't like going to a doctor that's only tied to one hospital affiliate and tied to the rules by that hospital affiliate. So that's one problem I see in the hospital models in the first place. Why don't they just focus on hospitals? But it's more revenue to them, so it is what it is. And the second is they should enable the antitrust agencies to account for better care coordination achieved through the merger, which goes back to the same thing. The argument of HCA saying, hey, it'll be great because we'll have more to service the people. And we're looking at, the main line is the argument to the FTC on that purchase is that the 2 competitors, which if you think about it, you have IHC at the top, HCA is second. I don't know who's third, why they're saying, and then fourth, because there's no other one entity. Those are the main 3, as we talked about. So I'm not sure how they're saying, 2 and 4. It'll become 1 and 2 competition between HCA and IHC, but they're for some reason not using IHC as part of that competition. And as I said yesterday, I don't see them pricing things based on each other's. It's not like 2 gas stations sitting across from each other competing with their pricing. There might be some things that they'll compare, but as a rule, they have their own. And they can't really, unless there's something major that they can justify the change. So I'm not sure what we're dealing with here. So it'll be interesting to see what happens, what the response is. Again, I'm not opposed to hospital systems. I think they're getting too, and I don't like doctors being employees of hospital systems, because then as the consumer, you're tied to their rules and regs that they have to follow. As an example, during COVID, people had to scurry for alternatives to get alternative treatment if needed, and where that goes. So again, doctors are given. I mean, it's bad enough that the insurance companies tell them how to practice medicine, and then they've got the guidelines. And I'm not saying that they need to. I just, as employees, they're not given that opportunity to have a lot of the alternative options that your direct primary care has. And there are a lot of timing. You have to get through these patients and get on to the next one, whereas with the direct primary care, it's a little bit different. So just some foods for thought. Tell me your reactions. Please share with others that everyone's going to get educated on all things healthcare and how we can improve where we stand in this whole tangled web. See you soon.